Hello dear students, this is Dr. Neha Taneja. Welcome back to my channel. So I am a public health specialist by profession, but by an educator, a mentor and guide by passion. So sometime back, I had put out a video on my YouTube channel regarding health education, where we had spoken about the principles, we had spoken about the approaches and everything about health education. Now, in today's lecture, what we're going to do is we will be doing the second part of it, where we will talk about various types to deliver, various modes by which we can deliver this health education. Okay, so if you've been wanting to watch the second part, this part is extremely important, where we'll be looking at the lot of types of health communication, which are lectures, symposium, panel discussions. So stay tuned for it. Before we begin, just a little bit about myself. As I said, I'm also an educator for PSM on Unacademy platform. You can also follow me on my Telegram group link, Telegram channel link for any PSM related updates and MCQs. Also, you can follow me on my Instagram channel, where I keep putting updates related to PSM and we keep discussing MCQs. For my Unacademy lectures also, you can click on the link. At Unacademy, we are launching a Target Next 2022 batch, which will help you prepare for next 2022. It will be based completely on concepts, building concepts, strategizing, solving MCQs, practicing MCQs. So it will be an high yield batch. These are your educators who will be teaching you there. I will be taking PSM from 18th of Jan onwards till 27th of January every day for 6 hours. So total it's a 54 hours PSM schedule. Similarly, all the other teachers will also be taking the rest of the subjects. So you can subscribe to this course and you can use my code PSM10 to get a 10% off. We've also started a target batch for FMGE 2021 on 14th of December. So you can still be a part of it. These are your educators who will teach you. I will be teaching PSM again. You can use my code PSM10 and get a 10% off. These are the links of some of my special classes. Currently, we are doing a series, PSM Recall series, where we are discussing all the previous year NEETPG papers. So you can join these at 9 a.m. in the morning. These are free classes, free live classes. So you can master your PSM by joining my free classes on Unacademy and, gain confidence in PSM. So should we start for the class for today? All right. So first we look at, when we talk about health education, we are trying to communicate to the people, we are trying to give them information. So there are a lot of ways in which that could be done: individual approach, group approach, as well as mass approach. Now over here, individual approach is like personal contacts, home visits, letters. Group approach is the most important one, and a lot of questions or MCQs come from this topic. So I will be telling you in detail about what's a lecture, what's a demonstration, what are the various forms of discussions, and of course, you can have FGDs, panel discussions, symposium, workshop, conference, seminars. What's the difference between all these? We'll be discussing in group approach. And mass approach is when we have to reach out to a larger audience. We do through means like television, radio, newspaper, health exhibitions, all these things, or even direct mailing. All right. Okay, so we can do this, like I told you, we can practice it via audiovisual aids, visual aids. We can make use of chalkboards, leaflets, posters, all these things. Now, what is the thing that we do in individual approach? When we are approaching an individual, okay, we are discussing with an individual, it provides us with an opportunity to change his behavior, provides us with an opportunity to ask questions. But the limitation of it is that we can reach a smaller number of people. Now, by health education, what do we actually want? We want that person to not just adopt a healthy behavior. We want the person to both adopt, as well as the important thing is to sustain that healthy behavior. That is why when we talk about health education, the next step in this is IEC, information, education, communication, and then BCC. Health education means you're educating the community about some, you're giving them some information. If that information, like suppose in some area immunization coverage is very poor, so you're providing them information regarding what is the importance of getting the child vaccinated. If they feel it interesting, then only they will try to adopt that behavior. That is IEC. Okay, it should arouse an interest in them. There are three steps of health education. Okay, first it should generate an awareness in them, all right, or slash interest in them. Okay, then they evaluate it whether the thing is right or wrong, and then it should motivate them to adopt that particular information that we are giving. So when they try to adopt it, it becomes IEC, information education communication. And when one person adopts it and then spreads that message to another person, and his or her friend or family members also start adopting that, it becomes BCC. So this comes as an MCQ. Basically, IEC plus a suitable environment is known as BCC. That means, suppose I tell that the immunization coverage in a particular area is poor, so we are providing all the information, we are reaching out to the people, we are reinforcing messages, that is IEC. But we need to provide a suitable environment. What is a suitable environment over here? That we should have dedicated health centers with health staff, keeping all the necessary vaccines with them, um, to vaccinate the children when the mothers approach these health centers. That is environment. If we are spreading awareness but the health centers don't have the vaccines or don't have the staff who is trained to do it, it's of no use. Therefore, behavioral change communication is IEC plus environment. This is very, very important. Next, in group approach, like I told you, we are trying to educate the community, and group approach includes a lot of things that we will be discussing right now. Okay, it includes one way communication also, and it includes two ways communication also. Okay, so here in this slide I'm going to tell you about the types of communications. Okay, this is very, very important topic. When we talk about types of communication, it can be either one way or it could be two way. All right, now what is one way communication? One way communication is didactic. This is the other term for it, didactic method. All right, and what is two way communication? This is nothing but Socratic method. Okay, now how can you remember this? Dekho, whenever we say buy, try, die, it means many. All right, but here it means the reverse. When we are using the word die, it stands for one way. All right, and two way is Socratic. So can I give you some examples of didactic? Most important examples of didactic are like TV, okay, like radio, like newspaper. All these are didactic. One very important method is lecture, that we'll be having a look now. All right, and what is Socratic method is two way. So all these things like panel discussion, okay, symposium, then if you say FGDs, okay, if you FGDs, if you talk about demonstrations, all right, if you talk about role plays or street plays, nukkad natak, conferences, ठीक है, conferences slash seminars, all these are example of two-way communication. Now how do you get an MCQ? You get an MCQ like all of the following are two-way communication or Socratic methods of health communication except. So you have to select your option. So please remember, one way is didactic, two way is Socratic. Now let's start looking at each of the methods. So the first one is lecture. Now lecture is very important, but it's a way to approach a smaller group. Now you'll be amazed to know that the size of the sample size of a lecture should not be more than 30. Okay, we limit to 30, and the talk should not exceed 15 to 20 minutes. This is very important. We can increase the effectiveness of a lecture, by showing using flip charts, flannel graphs, or trying to make it interesting. But the disadvantage is that there is audience का participation is minimal. Okay, audience participation is minimal. Okay, audience participation, what is the disadvantage? Minimal hai. And the next important thing is that at the end no feedback is taken. Am I clear? Audience participation is minimal, at the end no feedback is taken. Also learning is passive, it doesn't lead to you doing any problem solving. Okay, so that is lecture. So MCQ question 1 is this one, MCQ 2 is this one, and also no feedback taken can be MCQ 3. Done and dusted. Let's go to the other way examples now of two-way communications. Okay, now when we talk about demonstration, what is demonstration? It's carefully prepared presentation to show how to perform a skill or procedure. Like there are certain techniques that need to be demonstrated to people to arouse interest in them. Okay, to bring about desirable changes in the behavior. This upholds the principle of seeing is believing and learning by doing. Okay, so the most common examples, can you think about it, of demonstrations is whenever you approach a community and you want to spread awareness about taking care in times like diarrhea, or to preventing diarrhea, all those things, demonstrating how ORS is prepared. Many of them don't even know how to prepare ORS, in how much liter of water should ORS be mixed, within what duration it should be used. Another one is applying scabies ointment. Okay, so this also they do not know. ORS, applying scabies ointment, all these are important examples of demonstrations. Okay, and for your demonstration to be successful, after it's over, you should call somebody from the same community who was observing it and asked him to demonstrate whether he was able to or she was able to learn it or not. Okay, next one guys is group discussions. Now group discussions में wider interaction होता among the group members. The most important out of this, which is asked as MCQ for all of you, is focus group discussion. Okay, what is focus group discussion guys? Focus group discussion is very important. In focus group discussion, quite a number of the sample size could be 6 to 12. Okay, all of them, and usually focus group discussion, एक question आता है, is a way to collect data. Okay, but it is usually a qualitative technique. Okay, what is it? It's a qualitative technique to collect data. All right, now when do we do a focus group discussion? When we have certain issues like in which questionnaire based methods will not work. Like suppose there is a community, in this the prevalence of addiction among adolescents is very high. Okay, so I arrange a focus group discussion to collect information from the adolescents. So what I do, I call say 8 to 10 adolescents and I make them sit in a circle, and I am the moderator who's sitting in the middle. There is one person sitting outside who's the recorder, and there is one person who's drawing a very important thing in FGD, which is known as sociogram. Sociogram tells us how the participants who've participated in a FGD are interacting with each other. All right, so over here, whenever we talk about FGD, the topic that you select should be a focused one. It should also be focused by targeting individuals who meet specific criteria. Like I said, adolescents with where there is addiction problem is very high. The topic should be of interest to both the investigator and respondents, and emphasis should be on interaction between or among the group member. It's highly cost effective. Quality of data is enhanced by group participants. We get quality answers. That is what matters. At the same time, it's not boring. It's also enjoyable. But the problem is that some of the participants may be very shy, and if I ask question, like usually in a focus group we just give 8 to 10 leading questions. Okay, I just might throw a question as a moderator that why do you think adolescents of this area are drinking or smoking. Okay, so some of the participants may feel very shy in answering. They may feel that confidentiality is not assured. So these could be some of the limitations. However, it's very interesting, and from this then we develop a lot of themes, like peer pressure was one of the theme, domestic violence could be another theme, all right, and accordingly we provide the analysis. So what is this, everybody? This is a sociogram. This also comes as an image based MCQ. This is how the participants are sitting, you can see like this, and this is how the interaction goes between participants. Clear? So the moderator has to see, if suppose this person is only talking to this person, sorry, the moderator has to guide the person to, speak up. All right. Okay. Also, one thing I missed while talking to you about lecture, that lecture is also known as lecture is also known as chalk and talk method. Okay, sorry, it just slipped my mind then. It's also known as chalk or talk method. This is lecture. Okay, so this is the coming back to FGD. This is a symposium. See, in some sorry, that was a sociogram. So in a FGD, these could be the issues. Some person is going on saying, I know everything. The others would think his points are valid. I should change my view. So this is just an image which demonstrates the role of a moderator. All right. Okay. Now coming to two of the most important modes of health communication, a panel discussion and a symposium. Now, if I tell you, okay, I just wanted to look for a slide over here. Okay, we don't have as such. Okay. 1 second. Yes. So I just want to tell you the difference between over here only a panel discussion and a symposium. All right. Now, panel discussion and symposium both have experts. Okay, both have experts, panel and symposium. How many experts they have? This also has 4 to 8 experts. This also has 4 to 8 experts. But in a panel discussion, there is never like I've written over here, there is no specific agenda, no order of speaking, and no set speeches. Like I will just call certain experts to say about resistance among TB, resistance developing to TB bacilli. Just an example, okay? Or rising addiction among adolescents. So some experts will come, they will give their views. There is no specific agenda that first this person will say, then this person will say, then this person will say. No specific agenda, no order of speaking, speaking, and no set speeches. All right, but it is given, the given problem is always discussed in front of a larger audience, okay, and the audience participate at the end, okay, audience present, yes, all right, audience participate also at the end, okay, they participate as well as at the end. The only thing is there is no specific agenda, no order of speaking, like news channel. Okay, so every day they call experts to talk about something, and each one is just talking, just speaking on that topic in no set order. All right. Also, one very important thing in panel discussion is that experts, let me write it here, experts can talk among themselves. Okay, they can talk among themselves, like when you see in a news channel and the experts talking among themselves, that I do not agree to what you said, or I agree to what you said. All right, so that is how it goes. But for symposium, again there will be an expert, but there will always be a set, or there will be a specific agenda. Okay, there will be a specific agenda, there will be an order of speaking. Okay, specific agenda hoga, order of speaking hoga, and there will also be set speeches. Okay, everybody will get their turn. The most important thing is experts do not talk between themselves. Okay, sorry, do not talk among themselves. They cannot talk in between among themselves. All right. And also, what is important for a symposium? For a symposium, also audience is present. Okay, audience is present, and at the end audience also participate. Clear? So this is the difference between a panel discussion and a symposium. That's very important. So look over here. Here the panelists appear to be talking among themselves and the audience is also present. So this is an example of panel discussion. Okay. Symposium, like I said, series of speeches are given on a selected subject. Each expert presents an aspect of subject briefly, allows no discussion between the experts, but audience will participate at the end. And in both, the chairman provides a comprehensive summary at the end. All right, so this is symposium. Next comes a workshop. What is a workshop? Workshop क्या होता है ना? This just has one focus, to impart technical skill. Okay, to impart technical skill in the person. And whenever you leave a workshop, you always leave with what? You always leave with a plan of action on your mind. Okay, that okay, this is what I have to do. It helps you tackle a problem. So again, it is a series of 4 or more meetings. Okay, that means under the supervision of a consultant or two consultants, all the participants are divided into smaller groups. So that smaller groups is like 4 or more. Okay, 3, 4 or more. All right, and all these smaller groups, what do? They start discussing. They are given a problem and they start discussing it, and this helps them build their technical skill to solve that problem. Okay, so this is the features of a of a workshop. Okay, so always when you leave the workshop, you will go with a plan of action in your mind. Okay. Okay, what is role playing? Now role playing is also very important. If we see, what do you understand by role playing, guys? Role playing is called actually as a socio drama. All right, or it is also called as a street play. ठीक है, socio drama बोलते हैं और street play बोलते हैं. Now how many should be our audience size in this? This can come as an MCQ. Total audience size in a role play or a street play should be 25. All right, now what happens in a role play is that, suppose there are issues like stigma associated with HIV, life of an HIV positive patient. So what happens is that to reach out, to be able to reach out to people more and more, we have adopted the techniques of these. Okay, we go and enact, and this will help bring about a change in the behavior of a person, but the audience size should be only 25. All right, okay. Then comes conferences and seminars. So conferences or seminars are always held at a larger levels, regional, state, national levels. You will always see a huge audience. Okay, larger audience. What happens? Larger audience always participates in a conference and a seminar. Okay, larger audience is participating. At the same time of larger audience participating, at the same time, suppose at one place a lecture is being delivered, at some other place poster presentation is being done, at some other room in the conference oral presentations are being done. Okay, so simultaneously a lot of activities are happening in the conferences. They are usually regional, state or national level. Seminars are almost the same thing, but the audience size is smaller in a seminar. Okay, so these were the possible methods of health communication. One I want all of you to know is a Delphi technique. Okay, what is the Delphi technique? Now Delphi technique was currently asked in August FMG also, which students were not able to answer. They asked a question that, is Delphi technique an individual approach or is it a group approach? Okay, so Delphi technique is basically a group approach. Okay, in Delphi technique क्या होता है? It is a judgmental forecasting procedure for obtaining, exchanging and developing informed opinion about future events or a method for structuring a group's communication. So groups communication matlab group approach, so that the process is effective in allowing a group of individuals as a whole to deal with a complex problem. So of course Delphi technique is a group approach. Now I'm sure you didn't understand too much from this definition. In Delphi technique, what happens, guys, we have a series, we have an expert, okay, we have a series, we have a round of experts, okay, with us we have some experts on a particular subject, we have experts with it, okay. Then the consensus, or these experts will help us reach a consensus, okay, or will help us reach a decision. All right, so these experts will help us reach a consensus, or they will help us in decision making. Now, how do these experts help us reach a consensus or help us in decision making, students, is very important. How do these experts do it? Okay, suppose we have any topic, say for tuberculosis, a new diagnostic modality has come. We want to know about it. So we mail the questionnaires to a series of experts. All right, after them, they put their answers and the papers are mailed back to us. We see the agreement level, okay, in each of these answers, okay, of these experts. Then after that, suppose it's 70% agreement level with regards to those questions and on those topic. फिर हम क्या करते हैं, we again mail these back to the experts, okay, and we keep doing this process till we reach a common consensus, okay, till we reach a common consensus इसको बोलते हैं, or a common decision making. All right, so this is known as Delphi technique. So what are the points you should remember? It's a group expert, it's a group approach, it relies on experts, and it also relies on or it is done to achieve a consensus or decision making. This process could come as your image based question, okay. देखो, Delphi technique is elaboration by experts, assumption in key questions are given, expert round 1, round 2, so we keep having these rounds till we reach a common consensus, okay. All right, next what we have to know, last but not the least, about counseling. Counseling is a way to, when we talk about counseling, we try to influence the person behavior, help him adopt and sustain a behavior, okay. So it helps client manage the problems more effectively, to develop unused opportunities to cope more fully, to help and empower clients to become more effective self-helpers in the future. Now in this, the most important technique is gather approach. Gather approach is done for what? To it's known as contraceptive counseling, okay. Gather approach is contraceptive counseling. In gather approach, we are trying to bring about an informed choice, okay. We are helping couples make an informed choice, okay, and accordingly help in their decision making. All right, so this is very important. For gather approach, it's usually done in contraceptive counseling. We are helping them make an informed choice and accordingly make a decision. G here stands for greet the clients and make them comfortable and give full attention. A stands for ask their needs, their problems, their reasons for coming. Then tell them the different choices, options, methods that they have. Help the clients to make voluntary decisions, okay. Then if suppose they select OCPs as a method of contraception, explain them fully the chosen thing, like how it has to be done and all that, and return for follow-up, okay. So this is gather approach. Similarly, we have one more approach which is known as spikes approach. Spikes approach क्या होता है? Whenever you have to break some sad news, like event news of a cancer to a family, okay, or somebody suffering from HIV, we need to, whenever we need to break some bad news, all right, then we use what is known as spikes technique. What does S stand over here, guys, for? S stands for you set up an interview, all right, you set up an interview. Then P stands for you assess the perceptions of the patients and the family members. Okay, assess the perceptions of patients and family members. What does I stand for? Then you invite them to explain. So this is invitation to explain. Okay, that's so and so is happening. Then you share your knowledge. Okay, you share your knowledge. Okay, strategize. Also, you have to finally show some emotions, empathy. So emotions. And finally, S stands for you provide a summary of whatever you have chose, whatever has been selected, keeping their view also in mind, and provide a strategy. Okay, so these have come as MCQs, gather approach and also spikes approach. Gather approach is for family planning counseling, and spikes approach is for delivering a bad news. There is one last thing that I want to tell all of you is there is a term known as flannel graph. Okay, what is a flannel graph? Okay, what do you mean by a flannel graph? Flannel graph kya hota hai? That again it's a one way method of health communication only, in which series of photographs are posted. Okay, series of photographs are posted. Okay, or are posted or pasted, sorry, are pasted on a piece of cloth. Okay, on a piece are pasted where? On a piece of cloth. Okay, on a piece of cloth, or it could be a big chart paper also. Okay, but in correct sequence. So this becomes an impressive way of reaching out to the audience. Why? Because they can see pictures at the background. All right, so this is about it. Now if I ask you guys that what do you think is the most effective method of communication, you can think for 30 seconds and tell me. The most important, guys, is read somebody by interpersonal communication. Okay, which means in-depth interviews basically, then FGDs, all right, and then others. Okay, others could be any group method. Okay, so this is the order of most effective method. All right, also uh, this is how you can reach them. Okay, interpersonal, FGDs and others. Yeah, so these were the things that we should know about how we should reach out to the people. Okay, what is the best way to reach out to the people, which is the most effective way, interpersonal, FGD or others. Okay, so this was all about, I guess, health education, and I hope we've not left anything for you to I hope I've tried to make this topic easier for all of you. All that you have to remember is the individual approaches, okay, where we have interviews, in-depth interviews, group approaches in which we have lectures, role plays, demonstrations, symposium, panel discussion, all these conferences, seminars, workshop. What is the difference between all of them? I've already told you. Please remember about panel discussion and symposium. Also, you should know about mass approach. Now, if I asked you one question before leaving, what is the best method for mass approach? What is the best method for mass approach? And if I gave you topic this thing, options like A, TV, radio, all right, if I gave you like newspapers or internet, what do you think? Yeah, social media, rather I should say social media. What do you think? Yes, of course, the most important method is TV, because the rural areas might not have social media with them, but they will have internet with them. Okay, so I hope you've liked the video. If you have any comment, any questions to ask, put on the comment section, and do watch my videos on Unacademy. I'm here to help PSM learning and make PSM learning interesting for you, and it's highly scoring. So take care everybody. See you again till the next time.